County's Manukau struggled for years to keep up with the health needs of its population of more than 500,000, with high rates of poverty and obesity making the care more complex. The money will go towards 4 new operating theatres for elective surgery and more space and equipment to help with diagnoses. The DHB's chair, Manukau, says it's about helping to level the playing field.
If you're on the other side of the Tamaki River or the Manukau Harbour, you might get in to see the clinicians earlier than you would here.
Long waiting lists at the DHB were further set back by the resources needed to care for victims of the White Island eruption and more recently COVID-19. The Prime Minister Jacinda Ardern thanked the small number of staff gathered for the announcement, noting many of them had come back from leave to help in those crises.
We haven't always done the best we can in making sure we overcome those health inequalities. The hard-working, dedicated staff here, you deserve fit-for-purpose modern facilities to deliver the care that you wish to provide your communities, and we need to do better in supporting you in that work.
Last year, 35 South Auckland women had their breast cancer diagnoses delayed because of long waiting lists for the breast service, and patients on dialysis are often crowded into wards, some of which are in dire need of an upgrade. The money will help create more space for both. Chair Manukau says the funding's very welcome, but it's only just the beginning.
We've got some more business cases that we'll be working on because there's an opportunity to do a great deal more on the site. We've got some pretty antiquated properties elsewhere that deal with spinal and rehab, and our plans are to make this a health park that has got many, many services and to decongest Middlemore.
Like many other parts of the country, there are long waiting lists for MRI and CT scans, which are used to help diagnose cancer and other serious diseases. The money will fund new machines to help with that, although it doesn't address the deeper need for more staff to work them. Most of all, it's hoped the new facilities, mostly for elective and outpatient care, will free up space in the jam-packed Middlemore Hospital to make more room for those with serious illnesses. The Health Minister David Clark says he knows more is needed to truly give South Aucklanders a fair deal in health.
We do know that there are long-standing problems with the facilities and key infrastructure at County's Manukau DHB, and this investment at Manukau Health Park is part of an ongoing program, given the large amount of work that is needed to upgrade and remediate facilities here in the County's Manukau DHB.
The money given today has been allocated from the past 2 years' budgets, with the Health Minister saying it's too early to say what this year's money will specifically be used for. Mō te hōtaka o te ahiahi ko Rowan Quinn tēnei.